Opiates, opioids, and sedative hypnotics, as much fun as that is going to be. Maybe. There we go. Okay. Depressants depress the activity in the central nervous system. They sedate. They cause your muscles to relax. They may depress your inhibitions, such as your emotions and impulses. They mimic the natural inhibitory neurotransmitters, endorphins, enkephalins, and GABA, gamma-aminobutyric acid. Three major classes of downers. There are opiates, opioids, sedative hypnotics, and alcohol. We're going to talk about alcohol next week in Chapter 5, but we're going to talk about the opiates, opioids, and sedative hypnotics today. Four minor classes of depressants: skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Opiates and opioids include opium, morphine, codeine, hydrocodone, also known as Vicodin, oxycodone, also known as Oxycontin, methadone, and heroin. It was originally developed as painkillers, cough suppressants, and diarrhea treatments, and it still works as painkillers, cough suppressants, and diarrhea treatments. Sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. Neprobamate, also known as Miltown, is an example of a sedative hypnotic. Phenobarbital, Seconal, Doradin, methaqualone, which is commonly called Quaaludes, flunitrazepam, also known as Rohypnol, which is our roofies, the date rape drug, GHB, which is also a date rape drug, benzodiazepines such as Xanax and Valium. Alcohol, the natural byproduct of fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Skeletal muscle relaxants are synthetically developed central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. Examples are, I'm not going to read the chemical names: Soma, Paraffin Forte, Flexeril, Lioresal, and Robaxin are the common names. Antihistamines found in cold and allergy medications to block the neurotransmitter histamine. They're synthetic drugs used to treat allergic reactions, to prevent ulcers, to prevent shock, to prevent rashes, to prevent motion sickness, and to prevent symptoms of Parkinson's disease. Over-the-counter depressants, sleep aids, or sedatives such as Nitol, Sleep Ease, and Sominex. Active ingredients include scopolamine, which is truth serum, antihistamines, bromide derivatives, and of course alcohol. Look-alike depressants are rarely seen today, thank goodness. Opiates are products of the opium poppy, and this is what an opium poppy looks like. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower, and this is the seed pod with the sap oozing out. It will ooze for about a week. It can be milked about 6 times in any given season. Opium produces over 25 alkaloids. The two most important are codeine and morphine. Codeine makes up 0.7 to 2.5% of the opium exudate. So as that stuff comes out, about between 0.7% and 2.5% are codeine. Morphine makes up about 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is themane. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. And this is the way it is with heroin. It's a semi-synthetic hydrocodone, oxycodone, and hydromorphine, Dilaudid, Percodan, and Vicodin. Fully synthetic opiate-like drugs: methadone, Meperidine, also known as Demerol, and Propoxyphene, Darvon. Fentanyl is a part of this group as well. Synthetic opioid antagonists, naltrexone and naloxone. Opium poppies were first cultivated in ancient Mesopotamia. It then spread north to Greece and westward Egypt, eventually making its way east into Asia. And these are where civilizations developed in Egypt, Greece, and in China. Opium was, and India is another place where civilizations developed. They also developed in the New World, but it was later because humans started in Africa and had to wander their way to land masses, and they didn't come to North and South America until later. Opium was used in many medicines in the Old World, but its ills were seen even when various writers wrote of its addictive properties. Opium tended to be used as an additive, tended to be eaten, chewed, or mixed with liquids and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture mixed with alcohol with opium powder, and this was known as laudanum. He used it to treat dysentery, pain, diarrhea, and coughs. Laudanum, if you've ever seen a movie about Wyatt Earp, his girlfriend, when he first moved west, he's from Illinois. When he first moved west, his girlfriend was on laudanum. Opium continued to be used in medicinal mixtures for the next three centuries. Paregoric is tincture of opium with camphor. It was developed for the treatment of diarrhea. This mixture is still used today. My mother had gallbladder disease, and she called up the pharmacy, and she said, she called up the doctor, and she told the doctor she needed paregoric because she had this terrible case of diarrhea that had to do with her gallbladder, of course, and she was able to get paregoric. Tincture of opium with camphor. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredient into the system much faster, about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there's a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tin foil and inhaling the fumes through a straw. This is known as chasing the dragon, and that's what it looks like. Chasing the dragon. She's chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856, which was a war between Russia and England, and then during the American Civil War, which was, of course, 1861 through 1865. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong as the painkiller as opium. Codeine was used to treat coughs and general neuralgia. In 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, chest painkiller, and a treatment for tuberculosis and pneumonia. Now, why was it a chest painkiller? Because you have to remember that people were having angina, people would have heart problems, and there was no way to treat it except to make the pain go away. So they used heroin to make the potential heart attack, the angina go away. So individuals were able to survive from the pain. A lot of times they would start to have a heart attack, The pain was so intense that they'd go into shock and then they would die. But with a painkiller that could take the pain away, they were able to arrest the shock, and therefore the individual would live longer. And this is one of the reasons why a lot of individuals died in their 50s and 60s, because they had a heart attack and they had no way to stop it or to treat themselves, and they died. Heroin crossed the blood-brain more rapidly than morphine. The result was a more intense and rapid rush and euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half the opium addicts were women, and that was between 56 and 71% of all the addicts were women. Why? Because they used this for all their problems, depression, painful menses, whatever their problem might potentially be. And of course, more women were opium addicts than men. Famous opium addicts of the 19th century: Jane Addams, famous opium Sarah Bernhardt, Elizabeth Barrett Browning. She's an author. She was an actress. She was the first social worker. She opened a house for immigrants to help them assimilate to the American society in Chicago. Jane Addams. And she was an actress. Elizabeth Barrett Browning was a poet. Another author was Charlotte Bronte. She was an opium addict. Louisa May Alcott, she wrote Little Women and Little Men. She was a opium addict in the 19th century. Samuel Coleridge, another poet, opium addict. Charles Baudelaire, he was French. All of these people are either English or American. She's an American. She's English. She was English. She was one of the Bronte sisters. She was English. Louisa May Alcott was from the United States. Samuel Coleridge was from England. Charles Baudelaire was from France, opium addict and an author. Lord Byron was from England. He was a poet as well. John Keats was a poet also. He was an opium addict from England. Edgar Allan Poe, the famous author, was an American, of course. He was an author. Algernon Swinburne was a author and a poet from England. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed, limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. In 1915, only 63 people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of the narcotics violations. That's 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses, 155,900 prisoners out of 180,328. Now that we've changed, marijuana has been legalized in several states, about 20 states around the United States. The number of people in federal prisons due to drugs has been greatly reduced. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. The Chinese triads, the mafia from Italy, the the French Connection, of course, from Marseille, France, Mexican narcotraficantes, African traffickers, Russian mafia, and Colombian cartels. At present, 4.6 Americans use opioids illicitly every month. Only 136 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers, usually Oxycontin and Vicodin. A new wrinkle that is appearing in Dallas area junior and high schools is cheese. It's a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare, and the problem is that it is our youth. These are our children that are dying from this. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced in Afghanistan. Most of the world's legal opium from pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, to control coughing, and to stop diarrhea. Non-medically, opioids are used to drown out emotional pain, to get a rush, to induce euphoria, and to prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. Of course, the P doesn't stand for pain, it stands for peptide. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors. These are the opioid receptors, which are referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases your anxiety, it produces a sense of detachment, it makes the individual feel drowsy, it deadens the unwanted emotions. These effects occur because of the inhibiting effect of the endogenous or exogenous painkillers effects on the locus coeruleus. And as you can see, the locus coeruleus is right there in the brainstem. Opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, by inhibiting the action of GABA, by triggering glutamate receptors enhancing dopamine neurons in the reward reinforcement pathway, increasing the release and enhancing the effect of dopamine. And heroin has the strongest effect of all the opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that the act is more likely to be repeated, and it signals the alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. And if you've ever been around a heroin addict, you'll understand that this is really what's going on. They're not really seeking pleasure, they just want the withdrawal symptoms to go away. When an individual is prescribed opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opioids will use the drug in excess to prevent the withdrawal symptoms. They're seeking to return to the normal state, which doesn't make any sense whatsoever. If they wanted to stay in the normal state, they wouldn't have started taking it to begin with. Of course, that's me, the logical person, talking. Opioid Opioid and opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway, they block pain transmission, they change mood, they cause pupil contraction, they depress the autonomic nervous system. The autonomic nervous system, of course, has to do with your blood pressure and your respiration. So when you take an opioid, your blood pressure drops and your respiration becomes more shallow. It causes pupil contraction. Now, this is really kind of interesting because when working in the emergency room, if somebody comes in and they have low blood pressure and they have shallow breathing, the first thing you do is open up their eyes to see how large their pupils are. If they have pinpoint pupils, it means that they are potentially overdosing on heroin or an opioid. Kappa receptors induce dysphoria, they induce endocrine changes, and they control pain at the spinal cord level. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. They're widely used in Robitussin AC and Hydrocodone syrup. People will abuse these substances for psychedelic effects. Unfortunately, an overdose of the psychedelic substance, dextromethorphan, can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Opioids are also given to control diarrhea. Opioids works on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles, which slows down the activity in your digestive tract, which of course will control your diarrhea. If you're an opioid addict, you may suffer from severe constipation because this is all slowed down. And of course, since your waste product isn't moving through your colon, through your intestines and through your colon as fast as it's supposed to move through your system, you become constipated. Opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, your voice box, your muscles, your cough center, your nausea center, your reproductive system, your excretory system, and your immune system. Physical side effects of opioids, but especially heroin, includes insensitivity to pain, of course. It lowers your blood pressure, it lowers your pulse, it lowers your respiration rate, and it causes confusion. That sounds like a good time. At stronger doses, opioids, but especially heroin, might cause droopy eyelids, nodding head, slurred, slowed, raspy speech, slowed coordination, and walking gait. Oh my God, I'm on opioids. Pinpoint pupils, of course, as I said before. Histamine release causing itchy, dried skin. Suppression of the cough center hindering the clearance of phlegm. Vomiting due to the activation of the nausea center. Severe constipation. Delayed menstruation. Reduced testosterone production in males, dulled sexual desire to the point of indifference. Okay, so if we're talking about cocaine, we've already talked about cocaine and methamphetamine. It increases your sexual reactions. If you're taking, so a crack whore, an individual selling their bodies while they're on crack or cocaine is a very great possibility, and that's one of the reasons why we have problems with methamphetamine users being prostitutes. However, a heroin whore is not very likely because they're not going to be able to function sexually. If they're males, of course, they're not going to be able to have an erection. If they're females, they will be indifferent to any sexual response. Tolerance for opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver. desensitizing the nerve cells that the substance affects, increasing drug excretion by increasing urine, feces, and sweat output, alteration of the brain chemistry to compensate for the effects of the drug. If you've ever been around somebody who's trying to get off of opiates, opioids, their sweat is really quite odoriferous. It's quite smelly. Opiates, opioids tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opiates, opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Hence, these individuals have less of an ability to feel pleasure or even feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. And of course, that's one of the problems with taking any drug. You want to change your mood, you want to change the way that you feel, but all of a sudden you have to take more and more of this just to feel normal. Withdrawal from opiates, opioids may take place in 3 stages. The acute withdrawal, the body tries to return to normal too quickly. The post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. And the protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Now, this is a problem. All of these are problems, the withdrawal from opiates, opioids. People rarely die from heroin withdrawals. They rarely actually die from them. The problem is that they go back to the heroin because this protracted withdrawal, this post-acute withdrawal symptoms, it may last for a year and a half. It may, and it probably will, depending on how much heroin that you use. So you're going to be grouchy for an extended length of time, potentially a whole year and a half. People don't like that. That's why they go back to heroin. Even though they're not getting that much out of heroin, at least the withdrawal symptoms are going away. It decreases your blood pressure, decreases your body temperature, decreases your respiration, and feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. Now, if we're dealing with an individual that is an artist, such as a musician, and they are a heroin addict, as we see with some musicians, one of the problems is that their creativity is dampened when they go through the withdrawals for opiates, opioids. And the only way to get back to their productive selves is to either go back on heroin or wait for this extended period of time when they're primarily non-functional as far as their art is concerned. Short-acting opiates, opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. This includes heroin, morphine, and Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Doesn't take that long to get away from this stuff. But the chronic withdrawal symptoms, the protracted withdrawal symptoms, the post-acute withdrawal symptoms last for an extended length of time. And this is why they don't want to do it. Long-acting opiates, opioids will delay the withdrawal symptoms for 1.5 to 3 days. This is one of the reasons why people go on methadone. The other is LAAM. We don't use this in the United States as much as they do over in Europe. Peak withdrawal hits at the 4th to the 6th day, and recovery may take as long as 2 weeks if we use methadone, if we use LAAM, which, like I said, we don't use in the United States very often. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long-term opiates, opioids, codeine, Oxycontin, and Darvon. One of the curious withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by opioids. All in all, people rarely die from opioid withdrawals as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opioids withdrawal is the fear of the withdrawal, since this is the area of the brain that is mostly affected by the drugs. Neonatal effects of opioids usage are extreme because the drugs readily cross the placental barrier. Pregnant opioids users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. And as I have told you, I think I told you, my great niece was a heroin addict. She got pregnant. She was arrested for drugs, and the courts ordered her to go on a control substance so that that would lessen the effect on the child, on the fetus. Instead of doing that, she took not only the substance they gave her, but she was also shooting up with heroin, as her boyfriend and impregnator was her supplier. And he gave her all the heroin she wanted. So when the baby was born addicted to heroin. And what happened with my great nephew was that he went through 2 months of withdrawal symptoms. Finally, he was cleaned up. But to this day, he's 7 years old now. He started school, but he has problems in school. He has ADHD symptoms, but the biggest problem is his rage. He has rage effect. He has these episodes where he starts throwing things. And it has to do with the fact that he was addicted to heroin, and he will have this problem the rest of his life. The problem with rage. Hopefully, he doesn't hurt anyone. He's 7 now, and he's a big kid, nice and strong, but sometimes you can't control him. He just goes crazy and starts grabbing things and throwing them. If the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to size and dilution factors, the withdrawal symptoms are more severe. So, yeah, okay, we got a problem. When the baby was born, he was fostered out to his great-grandparents, my brother and his wife. Now the child lives with his mother. Curious situation. Not a very pleasant situation, but I want you to know that this is a problem that I've seen in my own family. It's not a pretty picture. I had seen this before, and I warned him when she was pregnant that potentially when the baby was born, the baby would be born addicted, and that they would have to keep him away from things that could cause him to be addicted, because now he is prone to become addicted to anything that you can overuse, such as, well, any of the drugs, tobacco, of course, alcohol, but obsessive compulsive disorder may be a problem that he suffers from in the future. And this is my great nephew. So I'm really upset. But that's the way it works. Low birth weight, high-pitched cry, they sound like a cat screaming. Irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. This is a continued problem. I saw this. I worked at a children's hospital in Omaha in the 80s when we first started seeing, it wasn't heroin addiction. At that time, it was cocaine and crack. And we saw the first crack babies when I was I was teaching junior high school in Oklahoma City, and one of my favorite students, or a student that said I was their favorite teacher, pulled a gun on me, the biggest smile on the face, and they pulled the trigger. Didn't shoot me, obviously. I'm still alive. Put it right to my chest and pulled the trigger. Luckily, the weapon jammed. It was taken away from him, and he was kicked out of school. He was suspended for bringing a weapon to school. This is back in, what year was this? 1991. If the neonate survives the withdrawals, the effects will last 5 to 8 weeks. And of course, his withdrawal symptoms lasted for 2 months, about 8 weeks. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day in the United States. This is last year. 47,450 people died of opioid overdoses in the United States last year. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioids were accidental. In other words, they overdosed on purpose. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate the blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. This is what congestive heart failure looks like. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins in their system. So we've got a really serious problem here, and we need to get their blood pressure up. We need to do something to clear that fluid out of their lungs. And this is kind of what COVID looks like, coronavirus. Their lungs fill up with fluid, and they can't get rid of it, and that's one of the reasons why they put them on respirators. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shot up for a year shows a rate of 71.4% of hepatitis C infections. 20 to 40% of these infected will develop liver disease. 4 to 16% will develop liver cancer and die from the cancer. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of the children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for the injection, so that the individual has to go to more and more difficult sites for their fix. They'll go to their wrists, between their toes, the neck. If they're male, they'll even go to the dorsal vein on the penis. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices because the individual is immunocompromised by the drugs being used. The severity of infections are sometimes catastrophic. This is true of Staph aureus and beta strep group A, which causes impetigo and strep throat. Staph aureus is the normal skin infections that we see, and that's what it looks like. Now, there are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where a virulent bacteria gets under the skin and eats tissue away, and that's what's happened here. Endocarditis, bacterial infection of the heart valves, and cotton fever, short-term bacterial infection. And this is an individual from Scotland. And he suffered from necrotizing fasciitis. He's cured it now. Well, it's everywhere except on the back. He's got still has a problem on the back. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug using tends to start at different ages. The mean age of first alcoholic use is 16.4. The mean age for first tobacco use is 17.3. The mean age of first marijuana use is 17.4. The mean age of first heroin usage is 22.2. From first usage to daily habit averages, about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half of them were dead, 50 to 100 times greater than the general population. Half of them were dead. They died from overdose, accidental poisoning. People killed them, homicide, suicide, accident, liver disease. Remember, 57% of the overdoses were intentional overdoses. 44% still used heroin of the ones that were still alive. 67% used tobacco. 22% were daily alcohol users. 35.5% used marijuana. 19.4% used cocaine. 10.3% used crack. 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system. Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as individuals get from an injection. Morphine will be detectable in the urine for several days after ingestion. One out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because the fear of tissue dependence and addiction, fear that painkillers would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Now, one of the interesting things about me is that I am not sensitive to opioids. I've had surgeries where I've awakened during surgery. I had my tonsils taken out when I was 20 years old, and they gave me codeine, and it didn't work. I had a knee operation in, what year was that? 2004. And they gave me oxycodone, and it didn't work on my pain. And the reason I understand that these didn't work is because when I took the codeine, I was able to use aspirin and the pain went away, but the codeine didn't do anything to it. When I was on oxycodone, I took Tylenol after that, and the pain went away. So I know that they didn't work, and I've awakened during surgery. About 1% of the world's population isn't sensitive to opioids. They did a study in Sweden where they looked, or Norway, excuse me. They did a study in Norway where they looked at a group of individuals, and what they found was that about 2.5% of the population were not as sensitive as other individuals to opioids, and about 1% weren't sensitive even a little bit to opioids. And I'm somewhere in between. You can knock me out with fentanyl, but like I said, I've awakened during surgery 3 times, which means that they had to hit me again with whatever they were using. Morphine doesn't work at all on me. I can't get any relief from pain. So hopefully I can use Tylenol. Works. Ibuprofen works, but I can't take it because it makes me depressed. So amazingly, if I ever have chronic pain, I don't have anything to take except not ibuprofen, but Tylenol. Because opioids don't work on me. So I'd be a really bad candidate for heroin addiction since it doesn't work on me anyway. Risk factors in morphine addiction include kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible to addictive substances. Now, you may think I'm the weirdest guy in the world. Caffeine doesn't work on me. Opiates, I'm not sensitive to opiates, opioids. I can't take ibuprofen because it makes me depressed. Wow, it's all these strange things don't work on me. And it just has to do with my biochemistry. There's something going on with my biochemistry. Am I a mutant? Well, maybe. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its #1 ranking has since been taken over by Vicodin. Okay, so hydrocodone. Pimp C and DJ Pimp C and DJ Screw died from cough syrup overdoses, and these are the two rappers. This was something that people were doing. They were going to the clubs in Los Angeles, and they were drinking bottles of cough suppressant, and it was the dextromethorphan that they were after. Well, you can overdose on this stuff if you drink too much of it, or you mix it with alcohol. Not the best idea in the world. These two guys tried that, and now they are no longer alive. Hydrocodone is also known as Vicodin, Hycodan, Tusend, and Norco. It's a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Methadone or Dolafine, it's also known as Darvon and Demerol, were developed in German laboratories during World War II. I'm sorry, Methadone, Darvon, and Demerol are three different drugs. They were developed during World War II. The Axis powers were cut off from supplies of opium, so they needed a synthetic, and they came up with methadone, Darvon, and Demerol. Methadone is less powerful than morphine and lasts longer in the individual system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States, with 228,000 heroin addicts using the methadone treatment. Hydromorphone is defined from morphine, and gram for gram is 7 to 10 times more potent than morphine. Hydromorphone, the common name for it is Dilaudid. You may have heard of Dilaudid. Because of its potency, hydromorphone is stringently controlled, theoretically anyway. Only medical personnel can get a hold of it, and unfortunately, they use it. Unfortunately, oxycodone is a semi-synthetic derivative of codeine and is used for moderate to severe pain. Other names for oxycodone are Percodan and OxyContin. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine and Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablets. Meperidine, also known as Demerol, Pethidine, and Meparagan. Demerol has been around longer than most of the synthetics and semi-synthetics. It is one-sixth the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effects of constipation. This drug is most widely abused by medical professionals. Demerol and Dilaudid. Penzoxine or Tolwyn is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get high because it has been mixed with naloxone. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wygesic. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if it's not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths using opioids have been seen with propoxyphene, also known as Darvon or Darvocet. Okay, I'm sorry. I was thinking something else. Fentanyl was the most powerful opioids as it is. It used to be the most powerful opioid, as it is 50 to 100 times stronger than morphine. It is used pre and post surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also oral transmucosal tablet called Actic, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. So if you hear of China White, what they're talking about is fentanyl. Unfortunately, some of the street drug contains MPTP, which kills the dopamine producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives. And that's the MPTP, which kills the dopamine producing cells. Not a really good idea. This is the street drug, it kills people. Fentanyl overdose deaths. Prince died of a fentanyl overdose death. Tom Petty had 3 different types of fentanyl in his system when he died. And Michelle McNamara is an overdose death. She was she was the first wife of Paxton, whatever that guy's name is. She was a journalist, and she was his first wife. So his children are by this lady. He's now married to, I can't think of her name. Forget it. Suvia. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Suvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose. Why in the world would they do this? Anyway, Suvia is out there, so be careful. LAAM is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every 3rd day, take-home doses are unnecessary, as it is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Naloxone and naltrexone are opioid antagonists blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effect of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naltrexone blocks the effects of the opioid for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse agonistic effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine or catapress is often used to diminish nausea and anxiety and diarrhea from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut withdrawal time in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days. Butorphanol or Stadol and Tramadol, these new synthetic opioids are developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as a Schedule IV drug. Sedative hypnotics are any drug that relaxes and soothes the body and the mind. Sedatives eases anxiety and induces sleep. That's what makes them hypnotics. That's why we call them sedative hypnotics. The two main categories are benzodiazepines and barbiturates. Benzodiazepine examples would be Klonopin and Xanax, or alprazolam and clonazepam. And barbiturates examples would be phenobarbital. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants for people with epilepsy in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body. Around the American Civil War, of course, people didn't live that long back then. They were only living into their 40s and 50s and 60s. Around the American Civil War, chloral hydrate started being used as a sleep aid and as a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, and pregnancy neuroses. It was used as the original Mickey Finn to knock out men so that they could be shanghaied. So you give them chloral hydrate, knock them out. They would wake up the next day, and they would be sailing on the ocean as a shanghaied sailor. In 1882, physicians began using peraldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms, despite addictive properties and an unpleasant odor. It's an aldehyde, peraldehyde. So it smells like formaldehyde or acetaldehyde, which is what alcohol turns to in your stomach. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates are any compound synthesized from barbituric acid, phenobarbital, cyclobarbital, and phenobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown or meprobamate was used fairly extensively as a sedative in the late 1940s into the 1950s. It became popular with housewives and came to be known as Mother's Little Helper. And if you listen to the Rolling Stones, in the 1960s, they sang a song called Mother's Little Helper, where they were talking about Miltown. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed. But in the early 1960s, when the Rolling Stones first started, when they wrote that song, of course, it was Mother's Little Helper. Glutathamide or Doradin was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. Of course, Doradin is no longer manufactured in the United States or used in the United States because of those facts. Librium chlordiazepoxide was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac in the 1990s. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves with just as dangerous withdrawals as barbiturates. During the Vietnam War, women whose husbands were overseas and they were showing a great deal of anxiety were given Librium and Valium to take care of these symptoms. Prozac actually was developed in the 1980s, It became common in the 1990s. Today, there are several new drugs that are being advertised as less addictive. Lunesta, Buspar, Rosarim, Ambien, Lyrica. Only Buspar and Rosarim have been proven to be less addictive than other sedative hypnotics. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At its point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get a high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by the physician. It is used in combination with other psychoactive substances for the synergistic effect or counteractive effect. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescriptions or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nimbutal and chloral hydrate in her system when she died. Dorothy Dandridge had high levels of the tricyclic antidepressant imipramide, also known as Tofranil, when she was found. Jimi Hendrix was a notorious mixer of drugs. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend and not to him. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate, and this was in Taiwan, where that is possible. Not in the United States. We control our medications. We control our medications better than that. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was the star of the hit sitcom Chico and the Man, Once Upon a Time. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. He died on the toilet. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died. Abby Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. Margot Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide in 1960. So she died in 1995. Rob Pilatus of Milli Vanilli, he was Millie of Milli Vanilli, died of a heart attack induced by a sedative given to him to help with alcohol withdrawals. He was taking the drug with alcohol, not the smartest thing in the world to do. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart, and he died of a heart attack. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and Playboy bunny from Texas, who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: oxycodone, hydrocodone, Xanax, Valium, doxylamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, and midazolam and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, Soma, and haloperidol. He had lethal doses of each of these drugs in his system. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with an alcohol level of 0.416. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana. Judy Garland had been a child star and had started a pattern of excessive work days fueled by uppers and downers. At 47, she died of a secobarbital overdose. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kirk Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janice Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from 1980 until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at age 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at 33. That's amphetamines and heroin mixed together. River Phoenix was a child actor from the late 80s who was headed for success. The star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers, he died of a speedball overdose outside a club in Los Angeles at age 23. Chris Farley was a comedian of Saturday Night Live fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. One other that I just recently found out about, Dolores O'Riordan of the Cranberries died of excessive alcohol use. She drowned in her bathtub in London at age 57, I think. 47? 47. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Sorry about that. Lots of people that have died, but a lot of people have overdosed. A lot of celebrities. Of course, there were a lot of people that overdosed who weren't celebrities that certainly didn't make the list. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are alprazolam, Xanax, 34 million prescriptions, lorazepam, Ativan, 19 million prescriptions, clondiazepam, Klonopin, 16.7 million prescriptions, Valium or diazepam, 12 million prescriptions, and Restoril, temazepam, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorders. It reduces anxiety and apprehension in surgical patients. You can use it to treat sleeping problems, to control skeletal muscle spasms, to control seizures, to dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs, as they are used to lessen the effects of withdrawal symptoms, methamphetamines, cocaine, and heroin. In one study, 100% of diazepam addicts were addicted to other substances as well. The typical benzodiazepine user is a white, well-educated 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, and the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam or Xanax is used for generalized anxiety disorder, panic disorder, and depression. Triazolam or Halcion is used for short-term treatment of insomnia, 7 to 10 days. Diazepam Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal dosage over a year. Because of the drug's lipophilic properties, even small doses over time can cause issue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1960s. Rohypnol has been banned in the United States along with GHB since 1996. Yet that is what Bill Cosby used when he used date rape drugs to rape women in the 90s and into the 2000s. Buspar is commonly prescribed as an anxiolytic or an anti-anxiety drug and in combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. F-chlorvinol is actually a chemical ether. Chloral hydrate is actually 3 molecules of ethyl alcohol fused together. Both of these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. So if you want to get drunk fast, take chloral hydrate. It's 3 molecules of ethyl alcohol fused together. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone. It affects our sedation, disinhibition, empathy, sensory enhancement, and euphoria. Its effects last for 3 to 6 hours. So this is one of the reasons why GHB is used as a date rape drug, because while this individual is on GHB, they're not very awake. They're disinhibited. They become very empathetic toward whoever they're dealing with. There is sensory enhancement, which means that the sexual encounter will be more enhanced, and it causes euphoria. So you can see why GHB can be used as a date rape drug. GBL and BD are drugs that are metabolized into GHB. These 2 substances have been formulated in mint-flavored rave elixirs, Blue Nitro, Revivrant, Gamma G, Rimforce, and Insom X. This is something that we don't see in the United States. Raves aren't very common in the United States, so be careful if you go to Europe and somebody invites you to a rave and offers you any of these. There is a possibility that they are trying to make you less aware of your surroundings, and you might suffer from date rape. Methaqualone or quaaludes are similar to those caused by alcohol and linger. Their effects are caused by Quaaludes' effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effect lasts for 6 to 10 hours. This is a drug that is often abused in South Africa. Very common in South Africa. It's also used as a sexual enhancer. So it's not really a date rape drug. It's one that is used by people as an aphrodisiac, I guess. This Lyrica, this drug is used to treat nerve pain from the shingles or diabetes and can be part of seizure treatment. More recently has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Rezurim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. It's used for short-term treatment only, so it would be used for a jet lag. When taken with alcohol, the result can be toxic. So you can use it for jet lag, but don't take it with champagne. You may kill yourself. Zaloplan, Zopiclone, and Zolpidem. These 3 drugs are known as the Z hypnotics. These drugs are short-acting drugs with 1 to 4 hours of half-life. The excess use causes nausea, headaches, diarrhea, and drowsiness. These drugs are rarely abused except with other drugs. And these are the Z Hypnotics. And that finally is the end of our lecture. So I'll talk to you guys next week. I think this chapter is good for 2 weeks, so I won't have another lecture until the 8th week, I guess. I think. Maybe not. I don't know. Anyway, fun chapter, not so much fun.